pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Dodoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Once again, it is time to come your way with the online pregnancy school. It is always a pleasure. I hope you have learned a lot since we started this online pregnancy school. Share with friends, share with family. My name is Dr. Linda Dodoo, and this is the online pregnancy school where we bring you a lot of information so that we can help you to have knowledge about pregnancy, delivery, and childcare. As you know, pregnancy should be a time of joy and not anxiety or fear. And when you have knowledge, you will be empowered to take action at the right time to have a good outcome. Welcome. Let's go for this commercial break. Welcome back. In our previous session, we looked at the stages of labor. And at that time, we looked at the first and the second stages of labor. We learned a lot from our own friend, Mrs. Felicia Dodoo. Mrs. Dodoo is a midwifery officer at the Greater Accra Regional Hospital, where she works with pregnant women. And today, we are happy to have her with us again. And this time, we're going to continue with our discussion on the various stages of labor. Mrs. Dodoo, you are most welcome.
Thank you. We have 3 distinct stages of labor, which is the first stage, second stage, third stage, and now 4th stage of labor. In the first stage of labor, that is the onset of labor till the full dilatation of the cervix. When we go to the second stage, as discussed in our earlier session, it is from the full dilatation of the cervix to the birth of the fetus or fetuses. Yes.
Okay. Thank you very much. So,
and in these stages,
Mrs. Dodoo has just given us a little recap, but we would like to know more. Maybe some people did not join us in the first session. So we want to know, Mrs. Dodoo, if you say that the first and second stage, and you have talked about the dilatation and up to the delivery of the baby, what is the full dilatation and what should the woman know? What are some of the signs that will show that this woman has gone into labor? Just to do a little recap of our previous session.
All right. In the first stage of labor, as I rightly said, they start from onset of labor to the full dilatation of the cervix. So that is when contractions set in, then the mucus plug falls off, and then your water breaks. The contractions, when we come to the contraction, we have false contractions and then true contraction, but it's the true one we are looking at here because that is when we could say the woman is truly in labor. So you can time the contractions when you get them to see whether the intervals are the same, whether they are regular, and then the intensity of the pain increases. That is when we talk that this is the true labor or signs of true labor. So the contractions, as we said, you can time as a pregnant woman. If the contraction is happening every 15 minutes, so let's say if the contraction starts at 9, and then the contractions begins every 15 minutes, is it happening? If it's so and it is regular and intense, that means that is a sign of true labor. You can pick your things and then go to the hospital, the health facility that you want to deliver. When we get to the second stage of labor, that is the full dilatation of the cervix to when the baby is born. And we have a tool that we use to monitor the woman in the second stage of labor. That is the pathograph. We call it the pathograph. So as you can see it here, we have the pathograph. We have the alert line and then the action line. So we have where the woman, if you are monitoring the contraction, in this tool, we use it to monitor the contractions, the fetal heart rate, the molding, the vital signs, and all that. So when we see that a woman is getting into the action line, that means we need to intervene. So this is the tool we use to monitor the second stage of labor. That's from the 4 centimeters to 10 centimeters.
Okay.
And then we have some complications that can happen in the first stage of labor and the second stage of labor.
Okay, thank you very much. Ladies and gentlemen, it means that if you are
in
at
the
home,
first stage of
this
labor
cannot be done at home. She has shown us the pathograph, which means this one you cannot monitor at home. She's told us about an alert line, which means that there is something going on, for which reason there must be an intervention. Okay, Mrs. Dodoo, please go ahead.
Sure. Yes. So in the first stage of labor, we have some complications that can occur. We have the fetal distress, that is failure to progress, normal labor to progress. We have placenta previa, as we mentioned in our earlier discussion. We have shoulder dystocia, malpresentation and position, and all that. And when we go into the second stage of labor, we can also have some complications that may occur in that. So all these things, we don't want them to occur during labor because you've taken the pregnancy for about 280 days or 40 weeks, and we want a good outcome so that there will be joy in the family and with the health staff. So we encourage all women to report as early when you see the sign of labor. If your contractions are regular, and as we recorded in our earlier discussion, at any point in pregnancy, in one way or the other, a woman can go into, some can go into preterm labor.
Yeah.
You are not 40 weeks, you are not 280 days, but you can go into preterm labor. So all pregnant women have to be alert on that. And when it happens and you are not 40 weeks pregnant, don't say you are not in labor, so you won't go to hospital. Maybe you are having a preterm labor,
yeah,
and then you can deliver your baby at any point in time. So when you report to the health facility as early as possible, we can intervene and then everything will be fine with you. And then as I showed in the earlier discussion, we have our cervical dilatation board. This is how your cervix have to dilate up to before the baby can be born. This is a 10 centimeters. So your cervix have to dilate up to this before the baby head can pass through your cervix to be born. So this is the dilatation board. It starts from here. This is how the tip of your cervix look like. So you have to dilate from 1 to 2, 3, 4. So the 10th one, this is the full dilatation of the cervix. This is where your baby's head can pass through your cervix to be born.
That is interesting. But don't be afraid, because God has made this in such a way that it can happen. Yes. It is like this. It can definitely happen. So don't be afraid. And you know, because it's starting from 1 centimeter to 10, you don't want to stay at home because you don't know what will happen along the line. And as we have heard, they have a way of monitoring you. All the terms that she used, you don't have to really try to say, what does this mean? What is molding? When you go to the hospital and you are in labor and they are using this tool, which she calls the pathograph, to look at how the mother is progressing and how the baby is progressing, it is all for your good. Please, it is for your good. So don't stay at home. Don't say that I am waiting, that when I go to the hospital, they will put their finger there, they will see how much. No. If you can understand these things, then you will be happy that these midwives and the doctors are doing everything possible for you to have a normal delivery. And the normal includes the cesarean section. What we want is that after you have gone through the 9 months of pregnancy, a woman will go home with her baby and she would also be alive. Please listen to the previous session on the stages of labor, the part 1, which was on the first and second stages of labor, and educate yourself about some of the things that can happen and for which reason you have to go to the hospital as quickly as possible. And please remember that you always have to keep your card with you. If you're a pregnant woman, whether you are going to the market or to church or wherever, carry your card so that if anything happens on the way, you have your card with you. The other thing that is of importance to note is that you have phone numbers. Husbands, please note the phone numbers. Ladies, give the phone numbers to your friends, give them to your sisters, give them to anybody who can call on your behalf if anything happens to you. Distinguished ladies and gentlemen, this is the online pregnancy school. And today we are continuing with our session on the stages of labor. And my guest for today, once again, is Mrs. Felicia Dodoo. Mrs. Dodoo is a midwifery officer at the Greater Accra Regional Hospital, or RAGE. Today we are going to look at the third and the fourth stages of labor so that it will be complete and we know exactly what to do. Let's go for a short break. You are welcome back. And before we went on the break, I told you that we are going to look at the third and the fourth stages of labor. And I'd like to now invite Mrs. Dodoo to take us through the third stage of labor. What happens? What should we know? And what are some of the things that unfortunately can go wrong? She's going to take us through all that. Auntie Felicia.
All right. In the third stage of labor, that is when the delivery of the fetus until when the placenta is delivered. And this stage takes about 30 minutes. And then this stage, that is when we initiate breastfeeding, skin to skin with the mother, the baby with the mother. So when the baby is born, we wrap and put it on the mother's abdomen. We put the baby on the mother's abdomen and cover to keep the baby warm. And then as soon as possible, we initiate breastfeeding. So the third stage is when the baby is born until the placenta is delivered.
Okay. Then that
And
is
in
very
the third
important.
stage, as we initiate, yes, very, very important.
Please go on.
So in the third stage, that is when bleeding is controlled. When the placenta is delivered, we have to make sure the bleeding is controlled. So as we put the baby on the mother's abdomen to initiate breastfeeding, it helps the uterus to contract. And then the blood vessels from where the placenta has detached now, the blood vessels which is causing the bleeding, the uterus contracts to also make the places sealed and then bleeding reduced. So it's very important we initiate breastfeeding in the third stage of labor.
Okay. Now, when the baby is born and the baby is put on the mother's abdomen and breastfeeding is initiated, what else is done for this woman after she has delivered? What else is done during the third stage?
During the third stage of labor, the woman is cleaned up. That is when baby and mother is fine. The woman, the cord is separated, and then the placenta is delivered. As when we deliver the baby, we make sure baby is breathing well, then we separate the baby from the mother. That is by cutting the cord and then the placenta delivered. So as soon as possible, we start to clean the woman up, check her vitals to see if everything is fine with her. So these are some of the things. Then we congratulate her. At that time, you could see there's some joy, even though she has gone through the labor with the pains. But when the baby is delivered, there's a great joy to the woman, and everybody around is happy.
Wow, everybody around her is happy, and that is what we want. But then we'd also heard that sometimes when the placenta is delivered, there's something that is done to make sure that there is nothing else left in the woman's womb. What is done to the placenta? Because some people deliver at home or they deliver somewhere else. So when it is delivered, what happens?
When it is delivered, we have to inspect the placenta to see whether the membranes are intact. Because if there's a retained membrane of it, it can cause the woman to bleed. So we examine the placenta to see if the placenta is intact. And then we massage the woman's uterus to make sure that the uterus is contracted. So inspection is very important in the third stage of labor to see whether the membranes of the placenta is intact. If it's not intact, we make sure all it's bring out.
Okay. Thank you. So you see, ladies and gentlemen, it is not just about the baby coming out. When the baby is born, examination is done because they want to make sure that this woman doesn't have any problem afterwards. So this baby is examined to make sure that the baby is breathing well. And when a baby is born, the baby has to cry. The baby has to breathe. The baby has to have a certain color. So these things are done immediately after delivery. And the woman also has to be well. So she mentioned vital signs. Vital signs, they check the mother's blood pressure, they check the pulse, they check how she's feeling and everything. And in addition to all that, they examine the mother's private part where this baby came from. So they want to see whether there is any injury, whether she has any cut, any tear. And most importantly also, they check whether the placenta came out as a whole thing. The placenta came out as a whole thing. And she mentioned the membrane. I'm sure we are aware that inside the womb, the baby lies in this sac. And this sac covers this baby. That is the membrane. And when the baby is born, they have to make sure that the whole thing has come out. And that is what is done during the examination to ensure that everything has come out. Auntie Felicia, what happens if some of it is left? If part of the placenta is left in the mother's womb or part of the membrane is left, what will happen?
It can cause the woman to bleed. That is termed PPH, postpartum hemorrhage. If it's left, we need to bring it out as soon as possible because it can cause the woman to bleed. Sometimes the bleeding is caused by retained placenta. By the time you bring it, something tiny, but that tiny thing can cause the woman to bleed. So it's very important that we bring all the membranes out. So it's very important you seek health care when you are in labor so that all these stages can be taken care of well to avoid any complications.
That is very important. And that is why
when we have some
to deliver is important, isn't it?
Yes, sure.
Yes, you were going to talk about other complications. Please go ahead.
Other complications can be uterine inversion. I've talked about the PPH already, and then retained placenta. These are some of the major complications we can have in the third stage of labor.
Okay. So what is the retained
And it could
placenta?
be avoided as we said. The retained placenta is some part of the membranes of the placenta retaining in the woman's uterus, which causes them to bleed and termed as the postpartum hemorrhage. And then the uterine inversion is we have the uterus to be like this, but sometimes if the placenta is so attached to the uterus, as we are pulling, it can go in like this. That's the uterine inversion.
Okay.
And all those things are complication in the first stage of labor. So we encourage the women to cooperate, to listen to their midwife during labor and cooperate with them so that some of these things can be avoided.
Okay. Now, there's also the case where when a woman delivers, and I'm sure you have seen quite a bit of it. Maybe she delivered somewhere else, but she comes to the hospital, the baby is out, but the placenta, the whole placenta, this time it's not just part of it, but the whole placenta is inside. It hasn't come out. Yes. Can this also be managed somewhere else, or they have to come to the hospital?
They have to come to the hospital. It cannot be managed at home. It cannot be managed at any other place, at a traditional birth attendance place. It needs to be medically intervened. So you have to come to the hospital.
Wow.
And these are the things that when you deliver at home and the placenta is not coming out and they are using force to bring the placenta out, your uterus can turn inside. That is the uterine inversion. So it's supposed to be attended to at the hospital, not at home, not anywhere. You have to seek a medical attention.
Yes. Ladies and gentlemen, this is important because there have been instances where women have delivered at home. The placenta has not followed the birth of the baby, but they have stayed at home for hours before getting to the hospital. And this, unfortunately, has led to infection and even sometimes death of the women because bleeding follows, and that is a very difficult thing to manage at home. We don't want you to do that. It is very simple. The hospital is there for you. Don't stay at home with trying to do something that needs to be done by somebody who has been trained to do that. Please don't do it. If you haven't gone to the antenatal and you get into labor, it still doesn't matter. We want you to go for the antenatal, but in case you did not do that, but you see that you have gone into labor, again, don't say that because I haven't gone for antenatal, I'm afraid to go. No, these days things have changed. Go to the hospital. And what does it matter? Even if you go and they say, Mommy, you were not coming for antenatal, but you are here, they will not say that because you did not come, will not deliver this baby and make you healthy. No. So please go to the hospital. It is very, very important for you to do that. Let's go for a short break. Yeah, welcome back. We are talking about the stages of labor. In our previous session, we looked at the first and the second stages of labor. Today, we are talking about the third and the fourth stages of labor. And I'm doing this with our own colleague, Mrs. Felicia Dodoo. Mrs. Dodoo is a midwifery officer working at the Greater Accra Regional Hospital, or RAGE. And she has told us from the beginning some of the signs that will show that a woman is in labor, what the woman should do, when she should go to the hospital, and some of the things that she should also not do, including delaying at home, because that will lead to a lot of complications, including, unfortunately, the death of the baby or mother or even both. And today we have also heard about what is called the pathograph. This is something that is used at the hospital when you get into labor. They use it to monitor the woman in labor to see whether everything is going well with her and the baby, or whether there's the need for the hospital to intervene to ensure that this baby comes out alive and the mother also stays alive. We have also heard some of the complications that can happen in the third stage of labor. Now we're going to move on to the fourth stage of labor. But before we do that, please remember that this program is proudly sponsored by Promise Ghana, which deals with life, the family as a whole. Vanuatu International, Reverse Tap. If you're having any party or any meeting where drinks are going to be served, or if you are selling drinks where people come to buy and you want to make it as hygienic as possible, please take their number, call them, and do business with them. It's also sponsored by Samzara Ventures. They are manufacturers of bubble gold liquid soap that you can use for your home cleaning, for washing your dishes, and for cleaning your hands. Don't forget that we are still in the COVID season, and therefore you have to continuously wash your hands. Keep your hands clean at all times. So use bubble gold liquid soap. And then it's also sponsored by Erama Clinic. You know, health is prevention, promotion, and clinical care. You can prevent disease. You can also treat disease. And Erama Clinic does everything. So if you are looking for a place where you can have this done, please call them. You can call them on phone. You can schedule a meeting. You can schedule a presentation. You can do everything that you want to do with them, and they'll be very happy. They also have other products which they sell. They have a pharmacy, and now they also have milk that is good for the whole family. Happy milk, as the name goes, it is happy milk. So you can use that. So please call them as their numbers come on the screen during the program. Call them, call any of these, because they have been helping us to bring you this program, which I'm sure has been helping a lot of people, because we have been getting a lot of feedback. And whilst the program is going on, if you have any question for us or on a previous session, please send me a WhatsApp message on +233 59 242 0625. +233 59 242 0625. And I'll be very happy to answer those questions for you. And if you also want to be a sponsor, or you want to get in touch with us in any way, send me a WhatsApp message on the same number and I will respond to you. Once again, my name is Dr. Linda Vanuatu, and my guest for today is a midwifery officer, Mrs. Felicia Dodoo. Mrs. Dodoo, now let's look at the fourth stage of labor. What happens? What should we know?
The fourth stage of labor is very important as well. In the fourth stage of labor, after placenta is delivered, we monitor closely of baby and mother. That is in the first 2 to 3 hours after birth. We have a close monitoring of the baby and mother. And at this time, any complication, we can detect it early with baby and mother, and then immediate intervention given. So we monitor the vital signs of the mother, the vital signs of baby as well. We check if mother bleeding has been controlled. We check for baby to see if there's any development of any complications that may be jaundice or anything, whether baby has pool or wee in the first 2 to 3 hours. All these things are checked. And then from head to toe examination of baby, everything, to make sure that there's nothing wrong with mother and baby. So it's a close monitoring of the mother and baby in this stage. And in this stage, most women, because of the blood loss during labor, some can go into tremors and then chills. They will feel cold. So at this stage, we encourage them to use more blankets to cover themselves to keep them warm, and then all the necessary things done for them. They can also drink or eat light diets if they feel hungry, because some will go into labor for days. So after baby is born, if you feel hungry, you can take something light, drink a little water. And then at this point also, the woman may feel dizzy or weak because of the labor process. So we encourage them to rest in bed, so that if they are fine, the necessary things can be done. And we don't forget our breastfeeding at all. We encourage them to still breastfeed. That is the time they bond with the baby. They bond with the baby. So breastfeeding is also encouraged in this stage.
Okay. You know, ladies and gentlemen, it is a very important stage. Very, very, very important, because this is the time that if you are not careful, a lot of things can happen. There have been instances where women have delivered and they say that this woman, oh, she just delivered and everything was fine. Then all of a sudden, she's found, unfortunately, dead in her bed or somewhere else. So Felicia is telling us that it is a very important time during labor. Although the baby has come out, the placenta has also been delivered, they don't leave this woman alone. They make sure that she's checked to ensure that she's not bleeding, because they will check to see that she's not bleeding and her breathing is good and the baby is also checked. So please, it is important that you deliver with somebody who has been trained to take care of you from the first stage of labor till the last stage of labor, when they are sure that everything is well. Another thing she has told us is some people feel dizzy. There are women who, when they deliver, they think that because I have delivered and blood has come out, I should immediately go and have a bath. I don't know. Auntie Felicia, you have been with them. Is it okay that as soon as a woman delivers, she gets up to go to the bathroom to go and have a shower?
No, it's not good at all. At least she needs to rest about an hour before all these things are done. And when a woman even delivers, we encourage bed bathing. We clean them up in bed for the few hours, because the loss of blood and the fatigue, they need to recover from that. So if you get up, you are going to the washroom or bathroom to bath, you can collapse along the way. Because of the blood loss, you are feeling weak, the fatigue, the stress you have gone through during labor. So you need to rest. The bathing, when you are fit in some few hours, we can assist you to shower or bath. But either than that, you need to rest for the few 1 hour in bed to recover from the fatigue that you have gone through. So they shouldn't rush at all to go and bath. They shouldn't rush.
They should not. They should not. So you see, if you are a bed companion, which means that you went with this woman to the hospital to deliver, and after she has delivered, the nurses have put her somewhere else because you deliver in one room and they send you to another place. Don't say that I'm going to help this woman to go and bath, because sometimes some of the people who go with them are the ones who say that after you have delivered, because blood has come out, let me take you to the bathroom. You don't have to do it. And because the number of clients there may be more than the number of midwives who are available, we would want to beg you, if you are a companion, somebody who went with this woman to deliver, when they bring her to her bed and you want to do anything for her, don't do it on your own. Kindly ask the midwives, can I do this? Can I do that? They would want to depend upon you to support them so that this woman, having gone through this journey of labor and delivery, will not go through a problem because you were trying to help. You see, most of the time, the companions are trying to help. They are trying to be helpful. But in doing so, you may do something that is not really what you are supposed to do. So please, 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 before you do anything for this woman, talk to the midwife, talk to whoever is available. Even if that woman is asking for something, talk to the midwife and say that my sister or my friend or whoever is asking for this, and I'd like to know whether it is okay for me to do that. Please, let's do that. Mrs. Dodoo, now the fourth stage of labor. What should other people know? What are some of the things that people do which are harmful during this stage, and for which reason we need to know about and we need to be careful?
I've heard women saying in the fourth stage of labor, because they have delivered and they are having the lochia, that is a normal bleeding that comes from the uterus for some time. Some women, I've heard weird things. Some say when you take this our local alcohol, that is aquateshi, it will help the bleeding to cease. And you could see relatives and friends smuggling alcohol to their friends to take on the hospital to for the bleeding to cease.
Wow.
It's so wrong. It's yes. So the lochia that comes after labor, it's normal. It have to flow for some time before it goes off. That is in the piperium. So they shouldn't worry about bringing some other concoctions to take to shorten the stages.
Wow. That is very interesting. You know, we have spoken about alcohol use in pregnancy. Some women think that when you are pregnant, you should be drinking a lot of, maybe
Yes.
a lot of alcohol just to help you to eat. So some of them do that almost every day during the pregnancy. But we have spoken about it, and in previous discussions, we spoke about alcohol use in pregnancy. Going forward, we will talk about the effect of the alcohol on the baby, and as this child grows, what happens to the child of a mother who was drinking alcohol. And as I said earlier, if you are helping the pregnant woman, please don't do anything that will affect her life. It is not true that when she delivers and she drinks alcohol, it will shorten the fourth stage of her pregnancy. It is not true. Don't do that, please, because remember that she's going to breastfeed this baby. So if you are going to give her alcohol, you are harming this mother and you are also harming the baby. It is not right. Now, Felicia, sometimes we hear that when women, maybe we'll go back a little to the second stage of labor. You know, at a time, the women feel like going to toilet. And this is one thing that some women find a little embarrassing. You know, it's embarrassing for them that they think they are going to go to toilet, and it is not something that they want to do in the presence of another person. What is it? Anything that they should be concerned about when they have that edge like that? Is it something that is something they should be worried about?
I don't think they should worry about this. I remember when I went to midwifery training first, our tutor told us that before you deliver the baby, there's a first baby you need to deliver, and that is the woman's poo. So with the midwife, we know we have to deliver two things at a time, and it's not your fault. Sometimes when the baby head is descending into your pelvic, it presses on the rectum. So even when you have a small amount of fecal matter in there, because of the pressure of the fetal head, the poo can come out. So it's not something they should be embarrassed, because I've heard women, because of that, they don't want to eat when they are nearing term for labor. And sometimes you may not get the energy to push or to go through the labor process. So they shouldn't worry about, we know our jobs, we have to do 2 things at a time. So they shouldn't worry about those who fast because they don't want to eat. Because of the poo, they will not get enough energy to push. So it's something they shouldn't worry about it. And we know how we go about it to make even the place so neat. We can quickly change your delivery mats, and then which will not cause any infection. We clean you up fast, which will not cause any infection to you. And then we even encourage the women to urinate frequently when they are in labor, so that all these things will prevent the uterine infections, as we talk about in the other stages of labor.
That is very important. So ladies, I brought this up because there have been challenges. In previous times with my experience in the hospital, the midwives are always ready. They know that as a woman, you may pass some stool or you may go to toilet when you are put in position to deliver. And like she said, when they are in school, they are trained so that when you are a midwife, you are conducting delivery and you see that a woman has pooped or passed stool, you will not be offended in any way. And that is why they say that they have to deliver too. Unfortunately, for some women, they know during their pregnancy from the hospital, from their records, that they have one baby inside the womb. But during labor, when the stools come out and they say, oh, the first twin has come, some of them take it that truly they have twins. And this has caused problems for some facilities. So please, it is the toilet that they are referring to. If you are pregnant and you have twins, you would know before you get into labor. Maybe from this, the midwives may now find another way of describing the stool that comes out. But it is just for them to be aware that a woman in labor can pass stool and they will not be offended. So you as a woman in labor, don't be shy. Don't be embarrassed if you go and lie down and when they say push, it is the stool that comes first. That having been said, it is also important that if you are pregnant and you have constipation, when you go to the hospital, you let the doctors and the midwives know about it. If there's anything they can do to help you to soften the stool for it to come out, you do that so that you are free when you get into labor. Some of them, maybe for days, they don't go to toilet. So when it's like that and they pass a lot of stool, then they are embarrassed. But don't be embarrassed. They'll clean you up nicely and then deliver your baby for you. Ladies and gentlemen, let's go for this short break. are welcome back. We are talking about the stages of labor, and today we are looking at the third and the fourth stages of labor. This program is sponsored by Promise Ghana, Vanuatu International. We are concerned about how people can develop to their highest level. And then it's also sponsored by Samzara Ventures, manufacturers of Bubble Good liquid soap. Again, we are supported by Reverse Tap. And as the name goes, the tap is from the bottom. So you find that the drink comes from the top. If you're having a party, call them. If you're having any meeting where you have to sell drinks, call them. And we are also sponsored by Erama Clinic. If you have never called Erama Clinic, I'm encouraging you to do that. You'll be very happy with the services you receive. They are very professional and they are very particular about the health of their clients. So call them and do business. They also have this milk, the Happy Milk, and they will tell you more about it. So that if you have any challenge with other milk that you use, this is an opportunity for you. So call them and do business with them. My name is Dr. Linda Vanuatu. Today, I'm having this conversation with my own colleague, Mrs. Felicia Dodoo. She's a midwifery officer at the Greater Accra Regional Hospital, RAGE. Mrs. Dodoo, now we have spoken a lot, and we would like you to tell us what we should take home. What are the key take-home messages on stages of labor? It can be from the first, the second, third, and the fourth, or all together, so that somebody who is listening to today's program would really put all of it together. So please tell us, what should be the take-home messages?
When we look at all the stages of labor, we could say it's quite a long journey for the pregnant woman. And then we don't want the pregnant woman to be left alone to go through all these processes. We need the birth companions to be part of it to give emotional support to the woman during all these stages of labor. And as we said, in all these 4 stages of labor, there may be complications which you cannot or may not see with your eyes. So you shouldn't delay when the onset of labor starts, which we said in our earlier discussion. We've described how the first stage of labor looks like, or when labor sets in. You should not stay at home. We have the midwives and the doctors. We've written our numbers in your antenatal book, which you can call at any time. And then we also check on our clients. So don't hesitate when you have any issues. It may be an onset of a complication which you may not know. So when you talk over with your midwife or the doctor, they will tell you the right thing to do. In all these stages, we shouldn't leave the woman alone. Their relative and birth companion should also be well informed. Follow them to the hospital, ask any questions that you don't understand in their antenatal book. And then when you are being discharged, there's a whole lot of things we teach you. You have to do the follow-up for immunization with the public health units, your breastfeeding, you come for your postnatal. That one, you shouldn't also take it out. After you have been discharged, it doesn't end there. The postnatal is very important. You come some few days for us to check baby and mother, because baby can start developing jaundice, which you may not know. So when you bring them for the postnatal examination, and then we ascertain that there's no problem with baby and mother, that is fine. So it doesn't end at the 4th stage, even though you are being discharged, but there are things you should also do after discharge. So we encourage our pregnant women and our birth companion to take the pregnancy school. Very important. They should ask questions. Whatever we teach them, if they don't understand, they should ask. Their husband should be part of it, because they are the ones who make decisions for them in time of need. So we encourage all of them that we should make pregnancy and the labor and delivery process a wonderful one, so that we can reduce maternal mortality and morbidity, and our babies too can be alive.
Mrs. Dodoo, thank you so much. Thank you for your time. Thank you for everything you have shared
Welcome.
with us. It has been wonderful having you for these 2 sessions on the stages of labor. I don't know, we are just about to end, but I don't know whether there's something that you wanted to say which you have not said yet. Then I'll give you the opportunity to say that before I say bye to everyone.
I think what I still have to say, it's the woman taking the appointment serious, and if noticing any deviation from their pregnancy, they should report to the hospital, and then the hearsay, because nowadays a whole lot of people have become midwives in the house and doctors, and they try to go contrary to what the advice we give.
Yeah.
The advice we give. So we encourage them that things have changed. Things are not the same as before. And then we have modern techniques that have come that we can use to help you in case of any emergency. So we encourage them to stick to the education that we give to the hospital, and then avoid the second opinion, third opinions. They are becoming too much. That is why we are encouraging them to come with their birth support person, so that it will make our work easier, and then we can all have a good outcome.
Wow, that is what we want, a good outcome. And so, ladies and gentlemen, we know that the pregnant woman hears a lot of voices, but they are not all good for her. And that is why we encourage you to take your antenatal seriously, bond with your midwife or your doctor, have regular interaction with them. And if you have any question about your pregnancy, anything you have heard from somewhere, or even read about somewhere, or heard from anybody, and you are not sure, ask them. Ask them. And then also be sure to know where you are going to deliver. Do not wait that when you get into labor, then you are now asking, where am I going to deliver? No. Because when you go to the antenatal, they will give you an idea of the time that you will deliver, the date that you will deliver. And that is written in your card. So if that is written and you are told that you will deliver probably on a certain date, then you prepare towards that date. If that date arrives and you haven't delivered, get in touch with your midwives or your doctors, because there's a period within which you will deliver. They will check it, see whether everything is okay. If they have to intervene, they will do that. If they don't have to intervene and they have to let you go on, they will also let you know. All we want to do is that we want pregnancy to be a time of joy and not fear or anxiety. Thank you very much for joining us today. Please go back to my Facebook page, Dr. Linda Vanotu, and check out the previous sessions that we have had. We have gone through so many topics. One topic which has generated quite a lot of interest is on infertility. There are so many people who unfortunately don't know that something can be done for them. So please check out all the previous sessions. And if you have any issue, any question, any comment, don't hesitate. Send me a message on +233 59 242 0625, and we'll be very happy to get back to you. Once again, I want to thank Mrs. Felicia Dodoo for her time and her knowledge that she has shared with us. My name again is Dr. Linda Vanotu, and it is a pleasure that I was able to host this program. Please join us every Saturday at 4 p.m. GMT for very educative and interesting sessions on my Facebook page, Dr. Linda Vanotu, and the YouTube channel, SHIC Ghana TV. Bye.